A very good morning and a warm welcome. This is Weekend Diary and we're live from the studios of the Nta Ado Ekiti. It's good to know you are joining us on this week's episode of the program. Weekend Diary happens every Saturday 9:30 a.m. on Nta Ado Ekiti. And on this program, issues of interest and concern to the society, and we'll bring experts who come here to dissect them, discuss them, and prefer solutions. On this week's episode of the program, I'm going to be looking at obstetric fistula. What exactly is obstetric fistula? I have an expert in the building who is going to be doing justice to that topic, enlightening us on what we need to know about this ailment and what we need to do to prevent the occurrence. My name is Amaka Igwe. I welcome you to the program. Let's take a very short break. When we return from that break, we'll meet with our guests, and I urge you to please stay tuned as we take this 1 hour ride together on the program this morning. We'll be right back. Please don't go anywhere.
Your favorite weekend breakfast show, Weekend Diary on Nta Ado Ekiti, your choice station, is now repackaged, repositioned, and reinvigorated to serve you better. Weekend Diary is informative, educative, and entertaining. It is out to add colors to your weekend. The captivating program comes up every Saturday. Time 9:30 to 10:30 a.m. on Nta Ado Ekiti Channel 5. You can also join us on Start Times Channel 103 or on Facebook Nta Ado Ekiti. For advertisements and sponsorship, please visit the Nigerian Television Authority in Ilawe Road, Ado Ekiti. You can call Samuel on 0706 29705. Weekend Diary, your ever-pleasing weekend breakfast show.
All right, welcome back from that break. If you just joined us, the program is Weekend Diary, and we're live from the studios of the Nta Ado Ekiti. We're also live on Facebook. Go to our Facebook, which is Nta Ado Ekiti Live on Facebook. We're also live on YouTube right now. Like I said earlier, we're going to be treating or talking prevention and treatment of obstetric fistula. Obstetric fistula is a serious childbirth injury that can cause significant physical and emotional distress. This condition can lead to chronic inconsistency, social isolation, and emotional trauma. Preventing and treating obstetric fistula is the focus of our discussion on Weekend Diary this morning. And I have the president of Association of Resident Doctors, Ekiti State University Teaching Hospital, and also a senior registrar, Department of Obstetrics and Gynecology, EXUT. My guest on the program this morning is Dr. Olatayo Ayodeji. It's good to have you on Weekend Diary, sir.
Thank you so much for having me.
All right, okay. Now we're discussing prevention and treatment of obstetric fistula. I hope I'll not bite my tongue today. Obstetric fistula. All right. Before we came here, we were also talking about VVF. Maybe that's a wider name for this. I would like you to give a feel to this thing. What exactly, to a layman, what is obstetric fistula, and what is the VVF, the general name?
Okay, thank you so much. Obstetric fistula is a form of vesicovaginal fistula, which is the umbrella category for an abnormal communication between the bladder, where urine is stored, and the vagina, which is the female genital part. Okay. And this, when it occurs, often leads to involuntary leakage of urine for whoever is suffering from such condition. For obstetric fistula, it's just that this abnormal communication results from childbirth. That is why they call it obstetric fistula. Okay. Other causes for vesicovaginal fistula includes the one that occur during surgeries that we call iatrogenic fistulas, the ones that occur as a result of maybe exposure to radiation, instrumentation, maybe bladder instrumentation, vagina instrumentation, sometimes even during female genital mutilation, especially in children.
Okay, let's do this. I think we are too fast. Let me ask properly. What are the causes of VVF or the obstetric fistula?
Thank you so much. For vesico-vaginal fistula, I'll take the umbrella category now.
Okay.
For vesico-vaginal fistula, just as the name implies, for a layman, vesicle relates to bladder, where urine is stored, and of course vagina. And then fistula is that abnormal communication between the two cavities. So vesico-vaginal fistula causes categorized into different headings. The first and the commonest is the obstetric fistula, like I said, which is the one that occurs during childbirth, as usually as a result of obstructed labor and oftentimes poorly supervised deliveries. While the second one, the obstetric fistula, is responsible for as high as 80 to 90% of cases in our environment. While in more developed countries, the commonest cause is the iatrogenic causes, which is the second category for causes of obstetric fistula. The iatrogenic causes are the ones that occur during surgical procedures, oftentimes gynecological surgical procedures, such as hysterectomy, which is the removal of the womb for people with some certain form of condition like a fibroid, or some form of cancers of the female reproductive system. They can have that procedure called hysterectomy. During myomectomy too, which is removal of fibroid nodules. During cesarean delivery, which is operative child delivery. Then during other surgical procedures that involve surgery within the pelvic cavity or within the abdominal cavity, all can result in the vesico-vaginal fistula. Another heading for the causes are what we call infective causes. Infections such as tuberculosis of the genital tract, schistosomiasis can also result in fistula. The schistosoma is like a worm. It can burrow between those two cavities and then form the abnormal connection. Exposure to radiation, which can come as an environmental exposure or as a form of medical therapy too. Because a form of medical therapy is what we call radiotherapy, which is often used as one of the treatments of some certain cancers too. And a complication from this can also be the formation of vesico-vaginal fistula. Some cancer of the genital tract can also result in vesico-vaginal fistula. Another heading is trauma. Any form of trauma, either from also procedure that can still come under the iatrogenic one, urethral instrumentation, bladder instrumentation such as cystoscopy, vaginal instrumentation, hysteroscopy, catheterization, or even fall astride during accidents can also be a traumatic cause of vesico-vaginal fistula. And like I mentioned earlier, female genital mutilation can also result, if it's extensive enough, can also be a cause of vesico-vaginal fistula.
All right, thank you very much. This also means that there's it's possible that it's not possible somebody will have this condition unless something is tampered on the person's body, maybe the reproductive system, due to medical procedure or due to female genital mutilation or trauma, like you said. Does food or lifestyle, can it in any way lead to fistula?
Thank you very much. Lifestyle, food doesn't really, it's not a cause of fistula. Although cultural practices under which female genital mutilation under which child marriages comes in, all those cultural practices can be a risk factor or a cause of another cause that I left out, which is more of the natural one, is what we call congenital fistula. That
Okay.
is the one that somebody is born
Born with. Oh.
So, but it is very rare.
Wow.
It is very rare.
All right, thank you very much. While you were talking, you mentioned environmental exposure to radiation. Okay, that is not for medical reason. I would like you to tell us what are those type of radiations that you're talking about.
For the environmental exposure to radiation, it is also a very rare cause.
Okay.
It will occur because the radiation is more of a general exposure, such as the radiation from masts, maybe telecommunication masts. People that work in maybe therapy centers are not receiving the care, but of course they are exposed to. People that work in factories where they are also exposed to a certain level of radiation. What radiation does is that it kills cells. So, and we know that cells are what forms tissues, and when this is targeted towards the tissue in between the bladder and the vagina, and then there is the death of the cells in between that we call necrosis. This can slough off and then form that
fistula. Okay. All right. It's not common. Okay. I asked because we are around where we have radiation also. Okay. All right. Thank you very much. Let's talk about the prevalence of prevalence level in Nigeria and in Ekiti State. Or is it something we see commonly around here? What's the prevalence rate?
Yeah. Vesical vaginal fistula is a public health concern.
Okay.
And it is a debilitating condition, as the sufferers not only does not only have to deal with the condition, but they also have to deal with the stigma, and the discrimination attached to the condition, even from loved ones and their family members. And because of this, a lot of people that are suffering prefer not to even present, so that they are not exposed to discrimination. Sometimes it could be as severe as resulting in loss of jobs, means of livelihood, because it's a condition that is associated with some form of social embarrassment. When somebody that is suffering from the condition comes into this room, people start looking at each other. Where is this girl coming from, and such things and stuff. So because of that, it has affected the presentation. Getting the exact prevalence, it might be underreported. However, in Nigeria, the incidence, especially for obstetric fistula, is put at about 3 per 1,000 deaths.
Okay.
So 3 cases per 1,000 deaths, around 3 cases per 1,000 deaths. But it is estimated that up to 12 to 13,000 cases occur per year. And we have close to 1 million people, 1 million women that are living with a form of vesical vaginal fistula or the other in the country as we speak. And this is a big problem, like I said, because we have less than 50 fistula surgeons in the country to cater for that level of
the whole of the country.
There are specialists, fistula surgeons within the country.
Wow. All right, thank you very much. Okay, does this... okay.
In Ekiti State, like I said,
okay,
there is no actual data yet for the number of fistula cases in reports. So the country as a whole is the one that have.
Okay, do you think this is as a result of the fear of embarrassment, the fear of being embarrassed or whatever? What do you think is the cause? Or do you think that we don't have the cases in Ekiti?
It boils down to a lot of things. An important one is the one you mentioned, the fear of embarrassment, stigma, and because the condition generally is an embarrassing one. Another one I just have to know is that even the awareness about the condition. Some people might be leaking urine and they might just feel, they might just be confused
What's
not know
happening to them?
exactly.
Or feel it is spiritual.
Yes, exactly. That's where I'm going because in our environment we tend to attach a lot of
Yeah, spirituality to everything.
spirituality to things, even straightforward medical conditions. And because of this, rather than coming to the hospital, we rather visit spiritualists, traditional healers, and what have you. Another one is because of the high cost of
The
it is
treatment.
capital intensive.
Okay,
Yes,
the
it is,
treatment.
yes,
Okay.
and we know that generally in the country, the level of poverty, I don't want to be saying, but very few people can actually afford standard health care. Not to talk of specialized, the level of specialist care that
This requires,
this
yeah.
requires. So that is also a deterrent for sufferers to present for care.
All right, thank you. Does it happen to men?
Well, it's obstetric fistula.
Okay.
And like we know, that things change. It is women.
Women that have, okay.
usually have,
All right, okay. All right. Can this condition be detected during childbirth? Can it be detected immediately and or maybe commence treatment if possible, or just do something to so that it does not escalate?
Yes, thank you very much. When we are talking about the treatment, of course, part of what we talk about is the timeline
Okay.
of care. And that timeline is dependent on when it is detected. If it's something that is detected immediately, it is even easier
Okay.
and better to just repair immediately, especially for the iatrogenic fistulas, because for iatrogenic fistula it occurs during surgery, and if it is noticed, of course, you can just repair there and then. However, for obstetric fistula, because of the mechanism of the injury, like I said, it's for the irrigation. So for obstetric fistula too, the mechanism of injury is that oftentimes for obstructed labor, what we call obstructed labor, and that is the one where because probably the size of the baby is bigger than the passageway, and the baby gets stuck during delivery or during labor, and because of this, the head of the baby is catching the vagina and the bladder tissue. In between the vagina and the bladder tissue is caught in between the head of the baby, which is a hard structure, the skull, and the mother's pelvis, which is also another bony structure. And when this occurs for a long time, it cuts off the blood supply to that tissue. Eventually, of course, blood is life to tissues. When that is cut off for long enough, that tissue dies, and then over time it sloughs off, and that condition sets in. So because of that mechanism of action, a lot of dead tissue around that place, which if you repair immediately, it will break down. So time has to be given for healthy tissue to develop around that fistula before the repair is done. So usually for obstetric fistula, a timeline of up to 3 to 6 months is given, where the patient is the time we use is well optimized. That is, we give everything to ensure that there are healthy tissue around that place, and that patient is clinically fit to even undergo the procedure required for the care. They have to check the blood level to be sure that it is optimal. They have to give, because a lot of the sufferers too, like I said, the level of poverty, are not even getting adequate nutrition. Some of them are malnourished, and because of that, even if you do the repair and they are not having enough nutrients to build new tissue, the repair would break down. So part of the care involves taking care of their nutrition, taking care of the blood level, checking some electrolytes within their system, and correcting anyone that is deranged. To involve probably putting in a catheter for some time to also allow continuous drainage and prevent urine and the chemicals in it from also further causing more harms around that area. So it requires a long list of care that has to be done for obstetric fistula. However, like I said, for the ones that occur during surgery, it is best repaired if immediately if detected during surgery.
All right, thank you very much. Okay, about the capital intensive nature of the treatment, let's come back to Ekiti. How accessible is the treatment in Ekiti? Is there a kind of maybe something that cushions the treatment expenditure, the capital intensive nature of the treatment for anyone in Ekiti State? Or can the repairs be done in Ekiti in your hospital?
Yes, the repair is available in Ekiti, and specifically at the Ekiti State Teaching University Teaching Hospital. As we have, like I said, there are very few fistula repair surgeons, but we are lucky that we have one or two in our center. However, like I said, part of the issue boils down to the affordability of that care, and we know that the state government is trying a lot in the area of women health care, but the attention is more towards preventing obstructed labor that can lead to fistula by offering well supervised labor by skilled health attendants and even by obstetricians. So that is the level of care, but specifically for care for fistula, I am not aware that there is a particular program for that in Ekiti. So that also affects the accessibility or the availability of the care. So of course the care is available, however, how affordable
is the issue. Okay.
Is it, yeah.
Do you think it is something we should begin to push for, that maybe government, amongst other things they do, should also look in this direction to provide succor for people who are living with this condition, going by the capital intensivity of the treatment?
Of course, every major obstetric or gynecology conditions require a high level of finances to take care of, and of course they require a high level of support and political goodwill for people to be able to afford it. There are a lot of ongoing efforts that have been done in the country, and of course that are still currently ongoing in order to address fistula cases. Part of those efforts includes occasional partnership between non-governmental organizations and the government to organize like a surgical retreats for people with vesicovaginal fistula, where they pull a lot of people suffering from the condition together and then offer the care, oftentimes free of charge, which of course free of charge is that the cost is being borne by
Right now, going by the money that is involved, the finances involved, and the shame, the emotional trauma, the isolation, and all of that. So I would like you to educate us on this particular aspect of the cause of fistula.
Well, obstructed labor is a dire condition, especially for in labor, as it can lead to an array of complications, one of which is the obstetric fistula that we are discussing. The obstructed labor oftentimes occur usually due to either inadequate or lack of antenatal care, and oftentimes due to lack of adequately supervised labor or deliveries. The lack of antenatal care comes in place because some of the labors that would have resulted in obstructed labor could have been identified earlier, even during antenatal periods. And of course, such patients, rather than committing them to vaginal delivery, would have been offered elective cesarean sections. However, for those that are falling in labor, if they have well supervised labor, there are telltale signs that would show that obstruction is about to occur. There are things that occur before that obstructed labor during delivery. And if for a trained personnel, if the labor is being supervised for a trained personnel, they can recognize that, such as prolonged labor and the use of what we call pathograph in monitoring labor, so as to prevent that prolonged labor from occurring. This would help to quickly decide patients that we need to stop the vaginal labor process and then commit them to also emergency cesarean section. So these are the things that should be in place in order to prevent obstructed labor. Other ones are part of the social ones. Other ones aside the antenatal care, the supervised labor, some of the social ones, like I mentioned earlier, that childhood marriages, teenage pregnancies, some of also the risk factors for this. The reason being that the pelvis of children is not adequately developed enough for them to start having childbirth, and oftentimes the baby, the pelvis is not adequate to allow for vaginal delivery.
That's it, yeah.
And it is usually this child mothers or teenage mothers that often does not have the capacity to receive the skilled care in labor. So you can see the chain of the processes that then result in them developing obstructed labor and peradventure obstetric fistula.
All right, thank you. We'll just keep talking because from what you just explained, it seems it's a chain reaction from one event leading to the other. A baby who is pregnant, someone who is under 18 is a baby. I will call the person a baby, is a child. Then from child being pregnant to a child who is pregnant will not be able to afford all the medical attention, might not be able to afford all the medical attention needed for the person to have safe delivery. Now, what do you think the place of poverty is in this whole chain of reactions or events?
Poverty plays a major role in the chain of events, even from the child marriages or the teenage pregnancy. Oftentimes it's as a result of pregnancy, because from a child that is from a well-to-do family would most likely be in school.
At that age,
yes, education is one of the things that are encouraged in order to prevent child teenage pregnancies, because if you are focused on education, and by the time you have a secondary and then tertiary education, you are well into your 20s, and we won't be talking about teenage pregnancy. And oftentimes, even child marriages sometimes results from poverty from the parents, because some of these children are married off to a more well-to-do person in order to probably lift the family of the child out of poverty. And sometimes to teenage pregnancy sometimes results from that, because for a teenager that does not get enough care from the family, and he has somebody that is given a cash gifts from time to time. By the time the person is propositioning such a person,
they won't say no.
Yes, it will be difficult to say no to that. So poverty plays a central role sometimes in both the cause and, like we discussed earlier, even in affording the
treatment.
care,
Yeah.
yes, the treatment.
Okay, let's talk about the FGM, the female genital mutilation. How does this also cause? Most of the times this FGM, they happen when someone is. Does it mean that the baby will start suffering fistula from when this thing was done to her until adulthood, or does it just wait until the person is an adult before it begins to show?
Thank you. Female genital mutilation, sadly enough, is still an issue in our environment, as it still occurs, though thanks to efforts of the government within Ekiti State, who has done a lot in trying to prevent female genital mutilation within the state. However, for people that undergo this female genital mutilation, there are different types, and depending on the type, the more severe types, which involves almost cutting off the whole external female genitalia. During that cutting off, it might be deep enough as to cut into the bladder from the vagina, and then of course that's link occurs where urine can start leaking from. So it would happen from the time of the mutilation, and if the person either does not present, of course, the child. So if the parents does not bring the child, and sometimes they might not want to bring the child because question will start being asked.
Where did you take her to? What happened? Yeah.
So oftentimes the sufferer might have to live with the condition from childhood till adulthood, at which time a lot of fibrosis would have occurred, which would even make the repair or the treatment a bit more difficult.
Wow. All right, thank you very much. Thank you very much for the education, for coming to enlighten us so far. It's time for us to take a short break. When we come back from that break, the conversation continues. Please don't go anywhere. We'll be right back.
Your favorite weekend breakfast show, Weekend Diary on Nta Ado Ekiti. Your favorite weekend breakfast show, Weekend Diary on Nta Ado Ekiti. Your choice station is now repackaged, repositioned, and reinvigorated to serve you better. Weekend Diary is informative, educative, and entertaining. It is out to add colors to your weekend. The captivating program comes up every Saturday. Time 9:30 to 10:30 a.m. on Nta Ado Ekiti Channel 5. You can also join us on Start Times Channel 103 or on Facebook Nta Ado Ekiti. For advertisement and sponsorship, please visit the Nigerian Television Authority in Ilawe Road, Ado Ekiti. You can call Samuel on 0706 297 05. Weekend Diary, your ever-pleasing weekend breakfast show. Your favorite weekend breakfast show, Weekend Diary on Nta Ado Ekiti, your choice station, is now repackaged, repositioned, and reinvigorated to serve you better. Weekend Diary is informative, educative, and entertaining. It is out to add colors to your weekend. The captivating program comes up every Saturday. Time 9:30 to 10:30 a.m. on Nta Ado Ekiti Channel 5. You can also join us on Start Times Channel 103 or on Facebook Nta Ado Ekiti. For advertisement and sponsorship, please visit the Nigerian Television Authority in Ilawe Road, Ado Ekiti. You can call Samuel on 0706 297 05. Weekend Diary, your ever-pleasing weekend breakfast show.
All right, welcome back from that break. If you just joined us, the program is still Weekend Diary on Nta Channel 5 Ado Ekiti, and we have been talking prevention and treatment of obstetric fistula. Before we went for that break, my guest on the program has said that female genital mutilation is one of the causes of this condition. Doctor, I would like to ask you, why do you think people embark on female genital mutilation? Why do you think that upon all the consequences and all the dangers, people in this time and age still take their babies to those places where their babies are mutilated?
Thank you very much. One of the reasons is a strong reason for that is more of a cultural thing. When something is done long enough, it becomes a tradition, and for a lot of people that doesn't even know the reason for the mutilation, they still take their baby because they feel a neighbor, it has been done in our family, so grandma did it for me, I have to do it for my baby, and so on and so forth. Other reasons for female genital mutilation, one is that most of the reasons have actually been debunked as being just mythical reasons. One of those reasons is that some of those who practice this feels that it would be a deterrent for promiscuity. However, data are there that shows that even in communities that have very high prevalence of female genital mutilation, there's still also high prevalence of high level of promiscuity and even marital unfaithfulness. So it doesn't work. So another reason is for religious purposes. Some believe that as it is done for male, in terms of male circumcision, that same should also apply to the women. However, I'm not sure that it's anywhere in the Bible that it is commanded that female or women should be circumcised. Then there is also those that feel still a cultural thing that the circumcision makes the female genital part more appealing to a partner or to a suitor, and because of that they do that. Some also do it as a rite of passage, as a transition into adulthood. So they feel that if you have not done that, you are not you don't have the right to be called a woman yet. So so many reasons like that does not really offer any particular benefit. Yes.
All of those reasons to me do not hold water. For instance, from what you said, people believe that when they circumcise their female children, it prevents promiscuity, and from what everybody knows, it's not true. It's not true. Then if it is not true, then the dangers associated with it, the dangers, even when it does not go full-blown problem, as in there are other dangers associated with it. I've heard people say on this program and other of our programs that because of being mutilated, they do not enjoy their partners or whatever sexual intercourse and all that. So have you seen that the dangers or the disadvantage supersedes whatever advantage you may think, which I don't even think there's anything advantageous about female genital mutilation. Now let's talk about, go back to the obstetric fistula we're talking about. What are the physical and emotional consequences of living with VVF?
The physical consequences and in fact the consequences of vesico-vaginal fistula or obstetric fistula are so, it's a long list, boiling from medical to physical to psychological, then to social problems. Part of the medical, so maybe I should start from the medical problem. The medical problem is, of course, even the condition, having to leak urine uncontrollably is a big issue, and of course that also can result in the urine has some chemicals that can cause certain skin irritation, that we call ammoniacal dermatitis, which is also a form of condition. And the physical ones are closely related to the medical ones, of course. The continuous leakage of urine, the skin irritation could cause certain level of continuous or recurrent urinary tract infection in people that are suffering from that. And of course, the social limitation. We mentioned stigmatization. It's can be bad enough that it can lead to people's partners or husbands divorcing them because of the condition. Family are stigmatizing against them or are neglecting them. Social gatherings like association or churches not wanting to be associated with them because of some level of things that are associated with, especially the odor and stuff like that are associated with it. Some people getting sacked from place of work also because, you know, somebody feels it's driving maybe customers away and stuff like that. So the social impact is so much, and from losing means of livelihood, losing, being neglected or being rejected by loved ones, of course the psychological effects comes in. They get depressed, they go into depression, you know, they are very sad, and of course it start messing with even their general outlook on life. And some can be so severe enough that they might start having suicidal thoughts and even going on to commit suicide in some cases.
All right, thank you very much. When someone has this condition, can they still give birth? All things being equal.
Yeah, the answer to that is yes. We have we've had people who experienced obstetric fistula during their first childbirth, and they've gone on to have up to 6, 7 other children, especially in some areas of the country where the obstetric fistula is much commoner.
Okay. Apart from the medical aspect of this, how can this be managed? Is it possible someone can live with this and still have a normal life? Without having to go through the repairs, the medical procedures?
Yes. Well, if we are to talk about the repair or the treatments, maybe I should just quickly talk about the diagnosis. Okay. In diagnosing vesicovaginal fistula, it requires a high level of suspicion, and the diagnosis often would depend on the cause. And to note that what we call history taking, adequate history taking has to be done. We have to ask the woman, when did she start noticing the leakage, if she has had any recent difficult delivery or difficult deliveries in the past that's occurred around the time that she noticed the condition, if she has had any recent surgical procedure done, especially for the iatrogenic causes, or for people that has had recent radiotherapy. Does she suffer from some form of genital cancers, and did she have any recent trauma? Another cause that I didn't mention is that is related to trauma is rape. So for a person that has just had an experience of sexual assault and then starts leaking urine, you can also link it to that. Female genital mutilation, like, because so the cause, getting to know the cause will depend on the history of the condition. Then having established the history, which gives us an idea of the cause, then of course we would examine the patient. Part of the examination will involve what we call sometimes examination under anesthesia, or speculum examination sometimes, for fistulas that are big enough, it can be visible to the naked eye. So a direct vision of the fistula can be seen, where an active leakage of the urine from that site is seen. Sometimes it might be just one fistula, sometimes there are multiple. Then of course the size varies. There are small fistulas, there are large fistulas, depending on the size. So from examination, so examination will also help to note if there are any fibrosis around the place, and then be able to determine what's best care the patients can have. So for as regards to care for small fistulas, there is what we call conservative care for them, where they are just a catheter. It's like a tube that is passed into the bladder, to allow for urine to pass.
Okay.
So this prevents the urine from passing through the fistula.
Okay.
And so it's like a diversion
Okay.
of urine from that fistula. So it will allow that fistula site, if it is kept dry enough from irritation of the urine, it can close spontaneously. So if it is small enough. So for small fistula, it might not require surgery.
Okay.
So just a prolonged catheterization for about 4 to 6 weeks might be enough to allow that fistula to close, to allow the healing. But for big enough fistula, or when that conservative care fails, then of course the next level of care is the surgical care. And the surgical care also varies depending on the type of the fistula, the location of the fistula. Like for vesicovaginal fistula, some can be high up in the vagina, and we call the juxta cervical fistula. Some can be around the middle point, and then some can be around the opening or the exit points of the vagina. So the middle one, mid-vaginal, and then the juxta urethra. So the location also determines the kind of surgery that will be done. And then there can be simple fistula, there can be complex fistula. So that also contributes, depending on the level of fibrosis around the fistula, depending on the number, and depending on the location, is what would be used to judge whether they are just simple or they are complex fistula. So that would also determine the form of care that is being offered. For simple fistulas, direct closure through the vagina is often the best choice or the preferred choice of approach to repairing such fistula. However, for more complex ones, or for the ones that are maybe higher up, there might be a need to use abdominal approach, where they have to open up through the abdomen in order to be able to access the fistula site. Sometimes there could be with advancements in medicine these days, there are what we call laparoscopy, where some instruments are used to assess the sites without having to put a large incision on the abdomen. They call them minimally invasive surgeries. Even these days in very developed nations, there are what we call robotic surgeries too, where it is even robots that performs the repair. So all this. So for small fistula too, there are some developed adhesive material that they call glue, that can just be put inside the fistula if they are not so big, and then it seals off the fistula. So those are the available options of both conservative and then surgical treatment. The principle of repair generally is to ensure that they allow that woman, like I said earlier, to be optimized enough to both be fit for the surgery, and then for that site to have grown, especially for obstetric fistula and for fistula from radiation. Those two would require a time lag between diagnosis and having to carry out the surgery. Yes. So
all right, thank you. And all of this can only happen when someone presents. If you're in your house, nobody will come to your house to know if it is just a minute procedure or whatever. Okay. Now, what's the surgery repair success rate? Do we have successes at all times that these procedures happen, or do people have to come over and over to undertake the procedures again?
Yes, thank you very much. The success rate is quite high. The initial success rate, let me put it like that, is quite high. The surgery, if done by a specialist that knows, that have the skill to repair, the repair rate is very good. However, the recurrence rate is also quite high. Because
what could make it reoccur?
Yes, so because aside from just having to close up the defects, the post-op care, like we call it, is as important as the repair itself. and it is during this post-op period, if it is defective, it will result in breakdown of the repair, and this results in a high level of recurrence rates for the repair, even for the ones that are successfully repaired.
Wow. All right, thank you very much. Now, I don't even know what to say anymore. I would like you to just advise generally. We have seen some of those causes, that early marriage, FGM, exposure to radiation and all of that. I would like you to advise people, like we have established here, that prevention is better than cure, going by the expensive nature of the treatment and the dangers associated emotionally or physically, someone being isolated or even being dejected by the loved ones. So it's better we preach the prevention than just wait to have it repaired or experience it. I'd like you to advise us generally.
Thank you so much. Like you said, of course, prevention is better than cure. We cannot hammer that enough, especially in the case of obstetric fistula, because even when eventually repaired, the emotional trauma, the psychological trauma that the sufferer would have gone through might be a lifelong thing, as we know that in our environment, so much attention on the mental health is not as paid as in so sometimes we just stop the care at the level of repair. There is what we call rehabilitation, even for those that have undergone successful repair, where they have to have care by psychotherapies, and then where they have to be reintroduced into the society, and the reintroduction will even involve economic empowerment, because like I said, a lot of them would have lost their means of livelihood. A lot of them would have been ostracized by their society, so they would need a lot of efforts in bringing them back to their former self, if that is even possible. In prevention, let me just address that by saying that prevention will start from awareness. So creating awareness about the condition, about what causes the condition, would help every people that should be involved. We tend to pay a lot of attention to what the government can do, in preventing obstetric fistula. It starts from what individual and communities are doing, because it is not the government that will hand over your child to somebody in child's marriage. It is not the government that is discriminating or stigmatizing people that are suffering from the condition. It is not the government that is making some people who can even afford it, going to traditional birth attendant homes to deliver. There is a need for high level of awareness creation on the condition, and even on centers where the care is available. Like I mentioned, the care is available in a center, but I'm not so sure that everyone is aware of that. So awareness has to be created to that. Of course, early diagnosis, early institution of appropriate care, and we cannot also still leave out the level of the place of government in providing facilities, training specialists that can offer such treatments. Thank you very much.
All right, thank you very much. Now that we have talked about awareness, I think I am going to say that it behoves on all of us, like on this program from time to time, we'll talk about it. Then as the president of the resident doctors, I think your association should do something in this regard. If it requires partnering with NGOs so that we can push this, there may be people suffering from this particular ailment that we're talking about, but will never ever present due to they don't even know what's happening to them. That it could be attached to maybe something spiritual, somebody's attacking them and all that. So let's do more by pushing it out there that this ailment has a solution and can be treated even here in Ekiti State. I want to thank Dr. Nta Ado Ekiti very well for coming to enlighten us on this program about obstetric fistula. Thank you very much. Dr. Nta Ado Ekiti is the president of Association of resident doctors, Ekiti State University Teaching Hospital, and he is also a senior registrar, Department of Obstetrics and Gynecology, Ekiti State University Teaching Hospital. Thank you very much.
Thank you so much once again for having me. It's a pleasure to be here.
All right, thank you very much. And that will be much we'll be able to take on this week's episode of the program Weekend Diary. Weekend Diary comes your way every Saturday, 9:30 a.m. on NTA Channel 5 Ado Ekiti. Please keep a date with us. Let's do this again next week, Saturday, by 9:30 a.m. My name is Amaka Igwe. Good morning. Happy weekend.
Another one, I think they can do it till I love. Waiting you love, oh, the reason I love.